last time in this studio. Welcome back to the Beyond the Scope podcast presented by NDMD Productions. This episode is sponsored by TrueLearn. More on them later in the episode. And with a lot of bittersweetness, I am your host, Andy, graduated medical student. I guess Dr. Andy now. And here on this podcast, we continue the mission sharing impactful stories from students, residents, and attendings of different medical professions while giving you an inside look into their lives, not just as healthcare workers, but the incredible people they are as well. But this is all about the things those years of medical training don't really prepare you for, things that are beyond the scope of our practice. So with that being said, let's introduce today's guest, who is a very familiar face, and I figured it was appropriate to close the loop here, as both of us are, celebrating really some transitions in our lives and in our medical training. So, Dr. James Williams, now, drumroll please, cardiology fellow. Welcome back to the channel as well as the podcast. Last time you were on was like 2 years?
Yeah, I think it was 2 years ago.
Years ago. You were finishing up your intern
year. Yep.
Yeah.
Yeah. Time flies. Yeah. Especially in medicine.
This is. I mean, I don't know why I'm getting chills right now. This is just. I'm probably making this a lot more wholesome than it needs to be. Because at the time of me recording this, I'm T-minus 3 days from my move up to New Haven. You're about to move on to your chapter as well, and I'm just grateful for our friendship over the years, like that extended before I even got into medical school. On the pickup soccer field.
Man, pickup soccer, man.
Yeah. And just the mentorship that you've given to me as well as so many other people at our medical school, like it's incredible, and big congratulations to you for moving on to the next step, man.
Yeah, I really appreciate it, and big congratulations to you. I mean, you're, Dr. NDMD now, man. You can't escape it now. Yeah, so, big congratulations to you, and thank you for having me here. It's been a long time coming, and, this is going to be my first time out of state, so even though it was probably like 15 minutes off the border. I'm just excited to be moving on and to be moving up to bigger things. So, thank you for having me.
Change is a change, no matter where. I mean, you know that this will also be my first time out of the state, a little bit further away than 15 minutes off the border.
It's a plane ride, man.
Just a plane ride or
a train.
14, 15 hour drive up the East Coast. But anyways, and also at the time of us recording, you just finished up your last internal medicine rounds.
Yep. Before
we hit record, we were talking about kind of all those feelings. So how do you feel at the end of residency compared to med school? I've detailed on all my videos kind of my feelings. So
yeah. I mean, so I think the end of medical school is a lot like the end of residency. It's a lot of feeling of, completion, accomplishment. You've worked a lot of hours trying to, accomplish certain goals. And so it feels a lot the same. I feel like this one feels a little bit different in that, I am like moving at the end of medical school. I'm at, here, so I knew I was going to stay. So it was actually an opportunity to, branch out and reach out to different friend groups and establish, connections here, a little bit deeper because, I knew I'd be here the next 3 years. So I guess that's how it's different in that, what's different between now and then. The satisfaction of just completing another step of, the training. I mean, that always feels great. So I'm just in that little, soaking it all in moment.
And I mean, you got so much to be proud of, and cardiology, dude. Cardiology. I'm so stoked. And so I think since now that you're kind of going, well, you've experiencing both of these transition points, what are some of the like similarities and differences that you felt? Like think back to that medical school graduation and going like, all right, Dr. James Williams now. Compared to this, where you're like, all right, I have 3 years of being a physician under my belt. Now it's time to hone in on something that I love even more.
I think, when you first graduate medical school, when you first hear your name, Dr. James Williams, the first instinct is to, think of, okay, yeah, that's maybe me, but maybe not. There's some, what I like to call imposter syndrome, where you feel like, somebody is calling on you with that responsibility of being, someone's doctor. And, it can be intimidating, sometimes, but it's something that you get used to. And so that's definitely a difference between, just graduating medical school, going like first day into intern year, versus now, being a 3-year resident physician. I think is a little bit different for me now in that, when I kind of go to this hospital now, it's going to be like, you're expected to be not only someone's physician, but somebody's consultant, meaning, you not only are you looking at, their heart, but you're like looking at their entire medical history, trying to understand how their total complex history can affect their heart. So it's kind of like, internal medicine plus. So I'm just,
good way of putting it.
I'm really excited to use a lot of my medicine background to help me, figure out, cardiovascular problems. We get quite a bit of that down here in Augusta, Georgia. So I'm just excited to, like you said, hone in on something that I just was really interested since day one. So
that's awesome. And I know you mentioned that kind of imposter syndrome feeling of having the responsibility of being somebody's doctor, and that, I'm not going to say fear, but, a healthy uneasiness that comes with something new. How long in your training did it take for that feeling to kind of disappear and to settle into that role of, oh yeah, I am this person's doctor?
Actually, I kind of started with the ICU. So, really after the first rotation, I mean, it was July 1st, 2021. And I think that's when Delta COVID was really heavy.
Oh, yeah.
And, ICU was my first rotation. So, it was a pretty quick turnaround from medical school, being the medical student on like an ICU rounds and being the intern. That was a bit different. So, as an intern, you're expected to be the primary contact, and you're talking to the family about what's actually going on. And so you kind of have to have like a really good fund of knowledge of what actually is going on with, all your patients. So, I mean, listen, day one, I had 10 ICU patients. So, I mean, we were like really stacked. The hospital system was really backed up at that point. So, really right after, like the intern ICU, I think is where I kind of wore like the biggest responsibility hat.
Mm-hmm.
And so I think after that I was pretty comfortable.
It's one of those things where they just throw you in the pool and it's like, swim.
Yeah, well, I mean, I'm really appreciative because after that, I was really confident in my intern year.
Mm-hmm.
And like I kind of could see how far, modern medicine could really take us. Even, some of the medicines and practices that we had to learn like while we're, going. So it was a privilege to kind of, come from that background like really early on.
Yeah. And I mean, we talked about this before we went live too. My first rotation, as I found out today, is surgery, which for particularly anesthesia interns, it's not the greatest lifestyle nor the easiest introduction into intern year.
Yeah.
So
well,
I'm trying to keep a little bit of your mentality as well, where like,
Yeah.
okay, it's gonna be a rude awakening,
Yeah.
but you're gonna come out of that like,
you're
ready.
you're gonna be, ready to face, some really critical patients, coming out of surgery. So that, I think, like you said, keeping that mentality will get you through it, and thinking about it as an opportunity rather than a sentence. Look, so I started off on surgery as a medical student in rotations, like right after step 1, like 2 weeks later, general surgery. So, I mean, I really adopted that thought process then, and it worked then, and I just kind of been drawing that lucky string, just So yeah, I think you'll be good for it.
And then obviously speaking of transition, I know I'm not gonna have the easiest one into residency, but especially you now as a senior, what do you think makes a good intern?
What makes a good intern? That's a great question. It's a bunch of things, man. A great intern is a great historian. When you first get a patient, definitely listening to the provider that's handing off to you, but just kind of doing a little bit of due diligence by, on your own, and taking the initiative to figure out who this person is, where this person's been. Also, just documentation. I know is one of the, mundane things of medicine, but a great intern, has like some at least good documents that are great for reference. I guess another thing, a great intern is very diligent with keeping in contact with patient's family. A lot of people will tell you that contacting the family, updating family, and just kind of, especially when things are going wrong or bad, then that's one of the harder parts of the job. And establishing that rapport and being human with these patients, that's what, like, the best doctors are the best humans. So I think really connecting to them and kind of figuring out how can you help them holistically. I think that's a good start.
And I think a lot of this, on the grand scheme of things, being a good intern physician. And then there's kind of the layer underneath that, like the onion layer of, all right, that's how you be a good physician to your patients and everybody. But of course, there's intricacies within like your own resident team. Now, even as a medical student, you experience those dynamics. So like, is there anything that like you've almost been surprised about, like your intern, as far as like a mannerism or things that they go out of their way to do, where you as a senior go, oh man, I didn't have to tell you to do that. You just made my life and everybody's life on this team so much easier. Are there anything like that?
Yeah, I think, some of the things that I named, and also, trying to anticipate the next step in management of care. That's kind of why we do all those questions that, what's the next best step in management, kind of using that and putting it into practice, some, getting used to simple, bread and butter cases. And then like, once you're getting a hang of that, start anticipating what's the next step. Okay, is this patient going home? Are they going to rehab? Is physical therapy work with them? Does this person have respiratory needs? Have respiratory therapy work with them? Coordinating care between the nurses, the interdisciplinary staff, is super key to patient's care. And when you're the primary contact for that patient, then it's kind of like you're their advocate on the medical side. If you looked at it as a room full of people, and they see maybe 50 people a day, you keeping in contact and understanding what's going on with everybody who comes in the room with you and your patient, that's kind of what an excellent intern is one who can kind of keep up with those things.
Okay. I'm gonna circle back to that question too, just because you've known me for a while, so I'm curious to know like your own personal suggestions and tidbits of advice for day one intern Andy, but reflect on day one intern James. Walk me through what you were thinking, especially with you hinted at it. 10 patients, ICU, Delta COVID. What are your what's going through your head?
Yeah, well, so first day it wasn't actually, we weren't full of COVID patients in the ICU. We actually only had 2 out of how many beds, ICU beds we had available out of our unit. But by the end of that rotation, we were the MICU's beds were all filled. The surgical ICU, neuro ICU, CV ICU, all of those ICUs were full of COVID patients. So, it really went from like 2 to 100, really quick. So, day one, coming into work is kind of like any other day, because I was, it's the same even parking spot, and it's for me. Right. I mean, I went from medical school to residency at the same place, so parked at the same place, came into the ICU, didn't expect much, but I know I was kind of like reading up a little bit on like critical care protocols and just ICU medications and procedures and things, so didn't really know what to expect, but boy, when I got to work, my my current chief resident was actually my upper level, and gave us a warm welcome. We had our white coats on, and we actually have like a picture going around where we're just all smiling, and we were just really happy to be there, but we got our assignments, and 10 patients, and that's quite a lot, and then we tried to get all of that done within a certain time frame. That can be a little bit hectic. It was a lot easier for me than my co-interns, because I knew the system, and I knew how to like look up things. I knew where to find critical information. I didn't have to spend a lot of clerical time, but presenting the first time, I mean, it kind of felt a lot like home. I had worked with a lot of these attendings before in residence. It was just a matter of oh man, everybody's looking at you with your paper, and you're kind of spilling the beans on what happened overnight and what their labs look like, what what's keeping them in the ICU, why are they critically ill. So I mean, and it was long. I mean, my very first day, it was 7 to 7, and I can remember my upper level, Dr. Khan, actually came to me at 6 p.m. and I was like, pecking away at notes, and he's like, hey, Dr. Williams, do you want to do procedure? And I was just like, of course, I've been like reading about, all these kind of procedures and what I kind of wanted to do, and they told us about different procedures we can do in the ICU, and we need to get signed off on certain ones. And so of course I like went to got really interested in the intravascular procedures, right? Getting access. And so actually my first day of residency, Dr. Khan taught me how to do a radial arterial line. So yeah, and actually got it on the first try. It was very cool. Like I was very I wouldn't say addicted, but it was very fun, or rewarding.
You throw it in blind?
No,
ultrasound.
we
Okay.
ultrasound guided, but I mean, you can see where you're going, rather than
blind is a relative term. We're not actually like blindfolding, and it's
right. It's just without like imaging, pretty much. So
just want to clarify that.
Yeah, but no. So we used ultrasound guided, arterial line placement. It was for like a critical patient who pretty much needed vasopressors for very low blood pressure, probably septic shock. So like looking back on it, it was a pretty small target, but was able to get it. I mean, it was just rewarding to be able to do those types of things, and that patient actually had a good outcome like later on down the line. So that was my first day. I mean, I was tired, but just being these people's doctor and getting through the day, and bonding with families, and just you get really close with the interdisciplinary staff, because I mean you really need them. They need you, so it's everybody kind of like works together. So I was tired, but it was a blast, to say the least. So
Rewarding.
very rewarding.
Feels like, all right, now we're in the driver's seat.
We're in it now.
Yeah.
You're here now.
No turning back.
Yeah.
All right. Well, we're about to zoom out from intern year a little bit more into just residency as a whole, so I have an idea of what in the world I'm getting myself into. But before that, we're going to take a short, quick ad break to thank our sponsor, TrueLearn, so we will be right back. I've said before numerous times on this channel, and I still stand by it, practice tests and practice questions are by far the most efficient and powerful way to prepare for your standardized exams, something medical training has a disappointingly large amount of. But in order to lighten the load and help you excel on your tests, I am proud to partner with TrueLearn, the sponsor of this episode. TrueLearn is a data-driven test prep resource with a 100% pass rate trusted by top institutions such as Harvard, Stanford, Mayo Clinic, and much more. Their smart banks with questions written by content experts give you the tools to succeed on your crucial board exams throughout your medical career. As a medical student, they offer prep for COMLEX 1 through 3, USMLE Step 1 and 2 CK, and USMLE and COMAT shelf exams. But it doesn't stop there. You have the same attention to detail and world-class practice test questions for PA, dental hygiene, MA, NP, nursing, OT, PT, speech therapy, pharmacy, and pharm tech licensing exams. For my residents, which I guess I will be soon, you also have resources for all your in-training exams, such as the ABA Basic for anesthesia, ABSITE for surgery, ABEM for EM, and much more. I've been using one of their smart banks to help me get a head start on my anesthesiology in-training exam and have been blown away by their performance analytics, real-time national benchmarking, and thorough explanations that help me to learn from even my most facepalm-inducing incorrect answers. With thousands of questions for each exam, you will be sure to have all the knowledge to knock your exams out of the park. If you would like to try TrueLearn, use code NDMD25 for $25 off your first subscription. Again, that's code NDMD25 for $25 off TrueLearn's incredible smart banks. Happy studying, best of luck to all those prepping for exams as you watch and listen, and of course, thank you to TrueLearn for your support on this podcast and the channel. All right, we are back. Did say we're zooming out to 1,000-foot view. What is something you wish you knew throughout residency or like coming into it that now kind of at the end of the road you're kind of like, should have known that?
Well, I don't necessarily wish that I knew anything per se, but I wish that, I kind of thought to myself more that, just be confident in who you are and trust that, things will work out in your favor. There is a lot of, thought process into, who you are as a doctor and as a person, and just knowing that, your best is good enough. You can only do so much in a day. There's only so many, tasks that you can complete. And even, if you complete all those tasks, sometimes the human body, does things that, you can't predict or can't do about. So I would say just, give yourself a little bit of grace when it comes to like self-perception, and, try to, not to focus on that more. So like focusing on, the good and like everything that's going on around you.
It's easier said than done.
Oh, absolutely. But when you practice it more, it becomes like a lifestyle.
Yeah. The self-talk thing, recently, of course, I've been playing a lot of golf, and that's apparently a very big thing. You make a bad swing, you get a bad break. My first initial reaction is, why in the world did you put yourself in this situation? Right. You're terrible. Sell your clubs. And anything in that variation. But of course, that has a lot of translation into just regular life. Of course, medicine too. Wow, I'm really making a comparison. Golf, medicine. Yes, I am. We're gonna run with it. Train's
Augusta,
already
Georgia,
started.
man.
Yeah, but like, I think my biggest struggle throughout all of this is that definitely that imposter syndrome of like when things are going good, I'm like I'm doing everything that I know I can do. You feel like you're on the top of the world, but the second that you make a mistake, and I've always been one to take full responsibility for that and look for areas to improve, and that will be my automatic response. Like, all right, let me read up on this or anything, but like the entire way home, I'm gonna be kicking myself into the ground.
Yeah.
Um,
I dealt with that a lot. I think, a lot more providers deal with that than would admit. You know, I would say, don't go at it alone. Talk to friends. You have friends in the medical community. Talk to, professional help. A huge advocate of, mental health and mental health awareness because, I mean, honestly, just, I can like smile about, that time in the MICU and COVID and things. And, it was a lot of stuff going on and things went right, but a lot of stuff went wrong,
mhm.
and, looking back and, seeking therapy for myself, I kind of ran into, well, a lot of times when I would hear COVID or see ads about COVID vaccines and things, I like would have flashbacks. So, you know, I mean, after a while, like, it just got to a point where, I said enough is enough and kind of like sought help. I mean, pretty much was diagnosed with PTSD from like a mild case,
Mhm.
but, recognizing that and, going through methods of therapy and talking about it, being open, I was able to like recover from that and, I can talk about it and like share stories without, really flashing back to the bad because I think that's a big part of medicine that, isn't really televised or, or if it is televised is, kind of spun in like a happy way, but a lot of health outcomes aren't that great, and, that's what we don't necessarily show,
Mhm.
in a lot of forums. So I would like definitely, that's one like key thing I would tell myself is just, really day one or even before, just in medical training in general, I would say like if you're, noticing signs and things just aren't, the same or, you hear a certain thing or you're feeling a certain type of way or you're starting to feel, negative, most of the time, recognizing the signs of burnout is like super critical. So I would definitely like say, know your okay, this is a hard line. Like if I have a chance to go play pickup soccer and I don't go, that's a problem. And I know that about myself. I started, the soccer group me.
Yeah.
I started at 7 years ago and if the group is going out and playing and it's a nice day, it's not raining, you're off from work and you're just not feeling it, like, well, why? That's like something that, even if you're, if I'm out of shape or, that's something that, brings you joy, each and every time, no matter really, even I can go out there and get hurt. I'm still having a good time, hanging out with friends, but recognizing that is critical,
Mhm.
like to moving on and being successful.
And I've used this phrase before that physicians are quite literally on, actually not just physicians, everybody who works in healthcare, um, are on the front lines between life and death, and you win sometimes. That really is the reality of the field, and the sometimes are great, the other times are not. And it's very easy, especially the type A personalities that medicine attracts, for people to take like extreme ownership in an unhealthy manner of a lot of those outcomes. And one, I want to thank you for sharing that you did seek professional help. One, as a physician, but two, also as a man. Like that is something that just is still. I know we've made strides for it within society, but you know,
Yeah.
it's still a little taboo for no
Sure.
reason at all.
Right. I mean, like, just be honest. Like, if your very first day as a resident was in the MICU and you're seeing a lot of COVID patients, you know, the ones that you see in a lot of videos, and they shut down, you know, my third year clerkships for 6 months, and you hear all these things, you're actually seeing bad things happen. I mean, you know, these are real things. I mean, there's no reason why, you know, someone couldn't come out and say, hey, like, for a little while there, you know, hearing COVID was scary. You know, I mean, that's a very human response, and I think, you know, it's time to kind of recognize that, you know, your psyche can suffer from, you know, human things like your job. So.
And we normalize a lot of this stuff I see. I mean, a lot of people in healthcare have dark humor, and like the general public will see that as somewhat crude at times.
Yeah.
But in many ways, it's one of the few things that allows you to walk in to work every day and still stay sane.
Yeah.
Really.
Yeah. I mean, that's one way to cope. One of my favorite questions to ask upper levels when I was an intern was, how do you deal with this? And the most common answer, you know, I mean, and it would be not like, how do you deal with this as in, you know, just residency in general, but how do you deal with, like, look, we're in a bind. We're in, you know, a rock and a hard place. There's no good outcome here. You know, when you got to go home, you know, recharge and come back, you know, how do you do this, you know? And, you know, the common, you know, cliche answer is, oh, you get used to it. But, you know, I was a challenger intern, but, you know, I challenged them to be like, you know, well, what do you mean by that? Like, how do you get used to it? You know, do you have any way other than just get used to it, just by repetition, that you get used to it? And a lot of my upper levels gave great advice, you know, such as, you know, find the things that you know that that makes you happy. For, you know, us as soccer, you know, do it, you know, and even if, you know, the group isn't playing, or, you know, we're not in season, still finding ways to just get active, even if it's just a walk, you know, or, you know, talking on the phone with loved ones, you know, even if it's just going to, you know, a local restaurant, you know, having dinner and a drink, and like FaceTiming, you know, your family member or something. You know, those like little things can really get you over big humps there. So when you're feeling like, you know, you're recognizing that you're burning yourself out or you're getting worked up, you know, seek, you know, other people, social beings. You know, if you're lucky enough to have, you know, people that are close to you, you know, reach out to them, because that's really a big part of it. Just don't isolate yourself. I mean, most residencies, you know, they have multiple people. You know, reach out to people in your program. Hopefully, you know, they have systems in place to, you know, help with, you know, those type of symptoms.
Absolutely. And I mean, I appreciate you being a challenger intern, because, you know, but that's the thing. So your seniors, you know, passed on that advice to you, and now you're passing that on to me and everybody else watching and listening to this. So like, that's important to dig a little bit more and not just take the, it'll be fine, as the concrete answer, because that's not actionable. And for a lot of very type A personalities that are in medicine, we need actionable advice, right? Not just generalities of, oh, it'll get better.
Right.
And yeah, I've seen that frustration with some of my other friends who are completing their intern year now, or their second year, where, well, they get up in arms about, like, no, it doesn't get better. Just get used to it, or you just tolerate it. And so like that advice is things that you can actually apply to your life. I'd totally plan on it too. I'd got a place with a good gym to make sure that I could do that. Hopefully, you know, anybody in New Haven Connecticut with like pickup soccer resources.
Pick him up, man.
I'm old and washed, but I can play still.
You gotta yell at him, but he'll pick it up if you yell at him. I mean, like, be playful, but like, yell at him. He'll pick it up.
Yeah. But that's all great advice. Now, is there anything that you wish you would have done differently, or anything along this path that you would say like I would have definitely done that in hindsight?
Not necessarily. I would say I would probably be a little bit more socially active in my residency. It was, trying to match, and then doing residency, you're working so many hours a week. You kind of lose sight of some social outings and things. So, but I mean, a lot of I just recently caught up with a lot of my co-residents that came in with me here, and a lot of them are kids or moving on to bigger and better things as far as like programs. So just that camaraderie. I mean, you can never spend too much time with the people that you're in the trenches with. Me and a few of my co-residents were supposed to play soccer a few times, and so I mean, it just, life gets in the way, so but I think that was about it. I mean, I wouldn't necessarily change anything. I really enjoyed my intern year. Really, second year, especially when you're trying to match internal medicine, can be difficult, can be challenging, because you're trying to publications, in research, you're trying to, be the best doctor that you can. You're trying to actually be a teacher and a mentor to other interns. You're still trying to like maintain that rapport with all the interdisciplinary staff. So busier services, you can, get caught up in that. So, wouldn't necessarily change anything. It was just, learn to appreciate where you are in my process. I think, intern year, I wasn't necessarily appreciative of, like the start of it until like I got to some other rotations, and, I could really see that, oh, okay, well, to prevent him from going to the ICU, I can do this, or these are the maneuvers I can do floor or on the step down unit rather than sending them to the ICU. Get a patient turned around before we get to that critical moment. So, just appreciating where you are, I'm definitely trying to do that now. So I'm not a cardiology fellow, guys. I have one more month, but yeah, I am done with internal medicine day rounds. Just appreciate the process. I think that's the best advice.
Sure. And but before I forget, because I'm sure there's a lot of people, my 73 question with Eddie, Dr. Hackler, did fantastic. Everybody wants to be a cardiologist. So, while we have a pending cardiology fellow in the room, can you just share like what drew you to cardiology, and also briefly go through like if somebody is in a medicine resident right now, kind of, playing with the idea of cardiology fellowship, how to go about that?
Sure. So I kind of got introduced to cardiology pretty early on. My dad was a CV ICU nurse for a lot of my childhood. So a lot of, take your kid to work day was, in the heart tower where he worked. So, I've always like been around like cardiac patients, and, just that population of patients are just an incredible group of people who, really appreciate their providers. They're really relying on you when you are given, the plan and, the medications and the treatments and the diagnostics. So, having a patient go through all of that, takes a lot of trust, in the physician. That's a lot of testing. That's a lot of, some of the procedures are invasive, heart catheterizations. But, having that conversation with them, and building that rapport with them, trying to get at, questions about if they're having acute coronary syndrome type questions, you know, taking it from, like if you're interviewing a patient, your initial H&P all the way to the extent of the furthest cardiology intervention, I think that's what kind of drew me to cardiology was, being able to establish that through that connection to that patient, you can kind of, figure out about what's going on with this patient, get more diagnostics, if you have time, and then you can actually, figure out bigger problems and hopefully fix bigger problems, than, otherwise. So that's really what drew me into it, like in the beginning. In medical school, like I just was fascinated with the physiology and the anatomy. Back to, freshman year anatomy class, finally got to cardiopulm. It was just, that was a good time for me.
Was not for me.
It was, then going on, like, it's just, I kind of niched into it, and I shadowed a few cardiology electrophysiologists before medical school. They happened to their whole group happened to be, African American. I just thought, like, that group, even just their symbolism was very powerful. And it just kind of, I was just drawn into it. I kind of came into medical school knowing I wanted to do cardiology. So it just, I'm just happy it all worked out. To answer your question for residents, I would say, if you're interested in cardiology, definitely do some type of rotation in cardiology, and really focus on, the patient population, focus on, the primary diagnoses that we kind of focus on, and really just kind of, find a mentor that you can see, yourself as, or you can see their work-life balance, or you can see their, just their job, their day-to-day, and it's like, wow, I can't believe it, but this is exactly what I want to do every day. Mm-hmm. And it's funny you mentioned Dr. Hackler. I saw him in Atlanta for ACC, and looking at like the cardiologist, or like how dynamic his day is, that's ideal. Just being able to read echoes, you can even do procedures like TEEs, working on a ward service, establishing that deeper connection, outpatient, like having all of that in one. I think that's really ideal. So I would say find mentors, immerse yourself in it by like getting on a rotation. And that's with anything. If you're interested in GI, if you're interested in hemonc, if you're interested in pulm crit, the people that do well and match into those places are like naturally drawn there. It's not like forced. It's not, you can see yourself treating these patients, years and years out. So yeah, that's what I would say is trying to do.
And I'm sure there's plenty of people listening, going, all right, yep, but either I'm doing all the right things or like I'm about to implement all those. So that's all awesome. It's also amazing that you and Dr. Hacker know each other. All the worlds are connected for me. I'm a big fan. So to kind of wrap things up, figured it would be kind of fun to give some lasting advice, and this for both of us. One you give to yourself, and one to the other person, which will be a ton of fun. I'm gonna let you go first, and you can start with like the advice that you would give to yourself, like right now, knowing it, like culminate all those experiences, compress them.
All right.
And then I'm gonna let you have at it with me.
Yeah. All right.
We'll see what happens.
I would say advice to myself. You know, I mean, take your advice. You know, enjoy the process. I mean, the first, I'm gonna be. They graciously put us on some less service heavy rotations first, coming into fellowship, and I really appreciate my program for that. But it seems like, right after I take my internal medicine boards, that's when, the grindstone is really going to be churning, and, I'll be getting to work there. So, just trust the process, enjoy the process, yeah. And, enjoy every moment of it, 3 years, 2 years, or, however long, since it's been our last podcast flew by. So, and a lot has happened in between then.
I'd say.
So just, be humble always, always, trusting God, and, let him, lead your practice, and enjoy everything, man. Enjoy life.
Oh, man.
Yeah.
Always
So,
nice.
so for you, I think, my advice to you would be, again, I think I've told you this before, but be nice to yourself. You're an excellent person. You're an excellent friend. Been a pleasure working with you, and all the crazy adventures we've had here in Augusta, Georgia. But find ways to, that inner voice is key in residency. And it's a lot of times where you feel like, sort of like your golf swing, right? Like, oh man, why did I use normal saline instead of LR? Don't do that.
I cannot believe this analogy is still going.
It's okay. It's all right. It's all right. Don't do that. But, you know what I'm saying?
Yeah.
Just, learning from those mistakes, right? And then like integrating that with your practice, like one thing that we all forget in this time is, this is, usually when you match into residency and even medical school, that's an education facility. You're there to learn. This is a learning environment. You're here to learn. And, of course, with healthcare, there's bad outcomes. But the key thing is to learn from those bad outcomes. That's why we even have an M&M, because it's, if we didn't go back and look at why, then we wouldn't advance in medicine and as providers, So learn, don't necessarily take everything personally. Use it as a learning, step.
Mm-hmm.
I think that'll take you far, because, when things are good, they're good. And when things are bad, you can learn from it.
Mm-hmm. For sure. I really do appreciate that, man. It's been fun. I think my advice to myself is very much similar. It's give yourself grace. Give yourself grace, and it's the hardest thing to do. Know what you can take responsibility for, and know what was not in your control to begin with. Things will always work out exactly the way it should. And I've been telling myself, God has revealed in so many moments, some kind of like in a haha, told you so way, but they all work out for a reason. And, I wish that I could tell myself that first, as an initial reaction to when things are like very confusing, when things aren't exactly going the way that I want them to. That's something that I would totally remind myself to. And I think the biggest thing, just I'm giving me this advice now because I know I'm going to struggle with it. Don't isolate. When things get crazy, keep everybody else in your life.
I'll come see you, man.
Yeah.
I'll come see you, man. I'll come like, hey.
Dude, New Haven's wonderful, man.
Have you seen NDMD around? I'm looking for a kid yay tall. He's a doctor, he sometimes has a great hair day. Some days it's like, whoa, bro,
Man.
I'll come find you, man. No, but seriously, you don't do that. That's how you can get into trouble.
And then just clip that so I can watch it over and over throughout residency. Is I've struggled with that before. It's a work in progress. And I greatly appreciate everybody who is patient enough to still be in my life when I'm, being weird. Um, and by weird, I mean like isolating myself when things get crazy because I feel like I need to handle my problems all alone. And that's something I'm more than willing to admit. That's not something I'm ashamed about because there's so many people out there that are probably nodding their head saying like, yeah, that's me too. Dude, for you, like, it's been 7 years, dude. I was a college freshman when we first met.
Really?
Yes.
Wow.
It's been 7 years. This is the end of my 7-year program, like, as completion. I just want to say, like, dude, continue to be the friend, mentor, and role model that you've been for me, as well as like literally hundreds and hundreds of students that have known you both like as a physician and not as a physician, just as James Williams, right? You have such an incredible attitude and an ability to pull people out of like some dark places, and I think I'm sure all your patients have grown to appreciate that and have benefited from that. But the little hundreds of doctors like that you have indirectly impacted and trained, can please continue to do that as a cardiologist when you're a fellow, when you're an attending. Like, you've made such a big impact on my life as well as so many other people at this institution, dude. Like, nah, bro.
Man, don't
Like
man, don't.
that's my advice to you. Just because there's a lot of tidbits and a lot of pieces of advice that I will carry on to my time in medical training, and I will, just as you have passed that on to me, I'm gonna pass on as a resident to my medical students, and hopefully continue that track on because we need better doctors in this world, and it starts here. So,
man, look. Trying to get me. I know I got you. You trying to play on some chords there. I see what you did there.
No, I'm not saying that for the cameras.
No, I know.
I mean that.
Yeah, for
like,
sure.
Seriously, it's been a journey. It feels strange, but before I like fully wrap up, I just want to take a moment to thank at the time of me signing and partnering with this studio, Augusta podcast, that is now Get Up Productions. Without them, this podcast would not exist. It has been going on for the past 2.5 years now. It started as a way for me to continue building connections and making content throughout my clinical years, and has blossomed into something that I never even thought it would. It's been such a beautiful addition to this channel and NDMD Productions. I want to thank David, Charles, who is currently behind the curtains right now, Ethan, who has started editing some of our podcasts. Like, seriously, y'all's flexibility when I cancel and have to randomly change schedules, y'all's friendships, all the good times, all the memories within this studio. Just thank you guys. Anybody out there looking for a satellite podcast editor, producer, please check out Get Up Productions. I mean that from the bottom of my heart. This is not sponsored. They did not tell me to do this either. I literally started this podcast when they were like a baby company, and now they've grown so much. And thankfully they've been able to see me and my channel grow along the years as well. So it's very nice to have all these people in our court, and you got to give credit where credit's due. None of this would have been possible without the support system that I stand upon. I think that's really all I have, James, unless you want to say some parting words, as this is technically the second to last episode of season 2 Beyond the Scope. I do intend on doing a season 3, that's just going to be a thought that I have in about 6 months after I get my feet settled into making Dr. Wynn sound less foreign.
Yeah. Say it again.
Are you really going to make me do this?
Yeah, say it one more time.
Dr. Wynn.
There you go. Yeah.
Okay.
There you go.
Still sounds weird.
There you go. Only because you struggle past it. So I'm just like, so I do like my med students. I'm like, wait. No, like, be confident. Be confident.
But
Dr. Wynn.
This isn't a presentation. This is
yes,
just
it
me
is.
saying my name.
Dr. Wynn. This is Dr. Wynn.
Anyways, there's a lot of transitions happening now. Tune into the season finale next week. We'll have Sean and Rachel in for it's already been recorded. It's an offsite one, but it is pure chaos. That one is just pure chaos, thanks to questions that my audience has asked. So stay tuned for that. But until next time, signing off from Beyond the Scope podcast. Thank you all for watching and listening.